and because of the time constraints that we have, we could go in for a Q&A session. Now onwards, let me invite Chandani and Adhika. Ms. Javadhan would like to come forward and just. So I'll Glenda. Yes, could you come forward? We can take few questions from the audience.
So I'm done, is it?
Yes, yes. You can use the.
I'm Dr. Kalinga Ginige. I'm not at all in nursing, but I'm more in health administration. I'm in the process of changing my institution for e-medical or electronic medical system. I particularly attended this session because I wanted to gather certain information on the nursing practices, right? So I might be a little awkward in asking these questions. First, I want to pose my question to Nadika. Is there an EMR system or a program that is there in Sri Lanka, or is there a software product that is available?
Currently, to my knowledge, I haven't practiced here, but to my knowledge, there isn't. But we were just discussing before that certain private hospitals start
in the ward practice, is it?
I think I'll get the help of there's ASIRE, our CNO Sahi, all three CNO Sahi, ASIRE group. Ms. Ashoka, in the ward management, is there a module for nurses in your software?
In the admission time, we are issuing an electronic card for the patient. When that patient is admitted again and again, so we don't have to press the patient and ask him the question about the patient's information, the age of the patient and patient's identity card number and address, everything is on that card. So when the patient is giving that card to the admission counter, if we need that past medical history of the patient, we have the record room, medical record room, when we can trace out that PhD.
It seems that it's still at a very generic level.
Again, the question to Nadika. Now you showed us something of dispensing medications, barcoding. Do you intend to carry this barcode reader towards the patient? And how about it on a different procedure, maybe IV?
Ideally, that would be safer if it was carried out to the patient. With the research that I was reading, the evidence showed that it was much safer. Having said that, there was non-compliance with certain nurses. They wouldn't, in a hurry, they wouldn't be checking the barcode, and so they would be going past the bypass. So there was non-compliance. But also, just coming back to the previous question, electronic health records are being implemented here, but electronic medication administration records haven't been.
Yes, this is the smart ward concept is, I just want to know whether the smart ward concept is on.
Glenda, can you add something on to smart ward? How is it in Australia?
I think that's obviously what they're using in Canberra. That was mentioned by the person who spoke with us.
That's nice, LFTL. There's a number of different programs that are available. Where I'm in South Australia, we've used a different program. Basically, they're all integrated, and what generally happens is the organisation purchases a program and gradually rolls things out. So at the moment where I work, we are doing the data from the patient's temperature, pulse, respiration things. We're recording those electronically. Some of the information that the medical officers put in is being done in that way, and of course all of the results from the x-rays and blood tests, all those investigational reports are in there, but we're not yet doing the medication. I think until we get to that stage where that gets barcoded into the system. So I don't know how you possibly decide what sort of program that you choose, because I think there's so many out there.
We have Professor Sama there. He could add some points to this.
Well, let me just give my 2 cents. There are there are ample product available. Either you pay for it or you can get for nothing. It is the matter of which one you want to go with, how it's going to help you in your context. So those who are asking about the electronic health record or health information system, there are open source product available. There are minor project going on in Kota Lawala Defense University. Those who don't know much about the Kota Lawala Defense University, I think Kitsi may know that. So they are aiming to use open EHR system. There are some product available from off the shelf from Australia, which even available for free of charge. There's a big industry in California called ZipD.com. They are happy to share their online data-driven modules with all the developing countries for zero cost. It's called ZipD.com. You can try and see, except the financial module, the rest of the modules are available for zero cost. Did they answer the question?
Yes.
Sorry, I think we will give you the contact details of Dr. Sama, so you can directly communicate.
I think most of my questions are. One last question to you, Natika. Is there a kind of breakdown or contingency plan of breaking down of your EMAR, getting back to manual in your kind of profile?
Well, I didn't hear the question, by the way.
I was asking whether there should be, or is it available, a kind of a contingency plan or a breakdown case, how to get back into the manual system and getting back to the e-medical again after the breakdown.
Well, if you are going for
We lost you for a while. Professor Ahmed?
Can you hear me?
Yes, of course. You can go ahead.
All right. So back in action now.
Yes.
Yep.
Yes.
I'm online now. Look, I'm answering the question fully. If you are going for EHR or electronic system, you must have a backup plan all the time.
Okay.
So you are going to use any pay for fee EHR system or electronic system, or using electronic system for zero cost, you should have a backup plan all the time. Doesn't mean you go for the paper-based system. You should have a backup offline system, right? So this is what the contingency plan you are talking about.
That's right.
So
I answer.
Thank you, Kavin. Thank you, Professor. Any other question from the audience?
Yes, there's a question.
Hi, I have a question to Ms. Tissera. My question is, when you interviewed the urban adult population, did you speak to any doctors as well and get their input on EMR products?
No, to begin with, I didn't interview. I did a online data collection method using a questionnaire. Yeah. So I didn't give the questionnaire to any of the doctors, but maybe there were doctors who were involved in answering. Among those participants, maybe there have been doctors, but no, there were no doctors involved. What I assessed was the public preparedness. If we are going to have a system in the country, what the public's perception is about.
Any other question? There is a question from Dr. Khan.
Yes, Shalini, you were talking about a password. will you be able to give little more data how you would implement it with the patient doctor institution? How would you go through that to get the records, the security, confidentiality, that part?
Yeah, so now it's like I didn't go into those detailed questionnaires, but it was like I just gave them a questionnaire. I asked if there are you using any password protection for your important documents? That was the question. So there were people who were using password protection on the important documents as well. There were people who were not using password protection as well. So in my findings, there was another one. There were people who used password protection and did not share their password with others. And there were people who had a password and then they shared with others as well. So this is more a cultural based country. So what I wanted to assess was whether the privacy, whether the patient concerns on privacy is like 100%. So if they are having a password and if they are sharing with someone else, whether the concept of password is secure.
I think we had a lengthy session with Professor Sama in the morning regarding the security and privacy issues.
Professor Sama, would love to add a few words?
Well, happy to share. Not few words. I can keep you whole night if you want to. Now, question is, it's not clear whether the password is worthwhile using or password is needed. Let me make this very clear. When you are in the digital space, nobody secure. 100% guarantee. Even you are in the paper base, you are not secure at all. The good thing with digital space, those who are going to be naughty, bad, you are responsible. You will be tracked, you will be cornered, you will be identified. The only trouble is if you are sharing the password, until you spit out, it is very, very hard to trace. Does that make sense?
Yes. Dr. Bale, are you online? Is she there? No? She's not there. Yeah. One of the things that we could look at Dr. Bale's research, whether we could do it in our setup and see how many kilometers a nurse would walk for a day and the rest of the work processes. Then you can actually look at, or there she is. Yeah. Dr. Bale? No, she's, hello. She's not there. So we could look at it, whether we could use those data in our context and see the same research and see whether how it works. I think, Tarindu, what do you think about looking at that kind of work processes of our nurses, because everyone complains that there's an increased workload.
Yeah, like as I always used to tell, like it's not because of the systems that we run, it's because of the duplication of work.
System, paper-based system. So anyway, like, that's obviously that's double work. So you got to test the system, you got to identify contingency plan, a backup, and like if you're sure with that, you should go ahead with that. If not, you should forget about these automated systems and go ahead with manual system without doubling the workload of nurses.
I think, thank you, Tarindu. Mrs. Javadan, we have a question for you. What, in your experience, what's a percentage of time that a typical nurse in a ward would allocate to during a 6-hour shift? If you can point out maybe first five things, major things that you allocate your time to.
Yes, nurses allocate their time actually for the non-nursing things. That means they are not doing direct nursing care all the time. Otherwise, they spend some time unnecessarily for non-nursing jobs, and if they reserve that time, they can attend to the patient care, more patient care they can give. And I think for this writing and documentation also, they're spending a lot of time. If they start writing these care plans manually, they have to spend a lot of time, and the communication will be, I think, that is lacking. What I feel, communication is a little bit problem among nurses and the other staff also. So with the technology, we can improve that. That's all.
Thank you. Any other question from the audience?
Can I jump back in?
We
Can you
have
hear me?
our CNO of the National Hospital here. I can ask a question from her. In terms of the workload, I think that's the heaviest hospital in Sri Lanka, over 3,000 beds, I think. Could you share with us your experience? What are the most common issues that you encounter daily in terms of nursing care?
Actually, according to Mrs. Jayawardena, almost our nurses also, we are having severe shortage of nurses in the wards, especially in medical units and the neurotrauma. Nurses have to spend their considerable time period for non-nursing functions in the hospital. If we can improve the systems utilizing these technology, thing we can save time and we can promote them to more bedside patient care.
Thank you very much, Mr. I think we have Miss Ashoka there. I want to pick her brains also. She's the principal of the post-basic nursing school. Giving the context of current issues that we discussed for the whole day, what role a nursing training institute could do, like yours? You get the experienced nurses coming in for post-basic nursing care training. What sort of approach that you would take to give solutions to the current problems?
Thank you so much for giving opportunity to share with you. Actually, as Miss Karunaratne and Ms. Jayawardena mentioned, acute shortage of nurses is a big issue. It's a big issue in Sri Lanka. So they can reserve time for better nursing care. If we can utilize nursing informatics, definitely we can improve quality of care. That's the first thing. And I think we can reduce legal issues because of this nursing informatics system. And especially we have to step forward with current technology and current medical education. Nurses are with less opportunity to have their higher education. If they can go with this informatics, as Tharindu mentioned, LMS system, those things are very much essential for the for future development of nursing education. We have to see this through Sri Lankan perspective as well as international perspective. Global nursing shortage is also an issue. If nurses are competent with these things, they can step up with global nursing education also. So that is very important and essential part to have nursing informatics all over the island.
I think this draws us to get an advice from Glenda. Glenda, we have a superb manual system. I mean, there's no doubt about it. Though we are overcrowded, our hospitals, I told you, 50 million patient visits, OPD visits per year, and 5 million inward patients. Now, how will you approach this is very raw. We are about to get into EMRs, we are going to implement these systems. how will you advise us? What is your experience in a country like Sri Lanka? What we should do first?
I wish I had that power to know the answer to the question. It's very, very complex. And as I said in my presentation, the approach that we have taken is that we are starting with the nursing education, and they get used to using online, able to resource information, becoming very familiar with that whole kind of world, I suppose. It's really difficult because you've got all those stores and stores of information. So how do you start saving all of that and recording all of that? It takes lots of effort, lots of time. You need a whole new workforce just to catch up on all that paperwork, don't you? So I think it needs to be a decision that's made sort of above the level that we're at. But I think from the point of view of what we've been talking about with the way people are working and the fact that we are able to influence them when they first start their nursing training, is that you get them working down that track so that when it comes in, they can be the change agents within the organisation. So they're not fazed by it, they're familiar with it. So us oldies in the hospital who go, oh, what do you mean? I'm not going to write it down. You know, that more people will be coming through with that skill and knowledge to undertake that, I think. So thank you very much for asking me to answer that question. I apologise that I didn't really say anything.
Any other questions from the audience? Anyone? So let's conclude this session. Before I conclude the session, I will invite Ms. Ashoka to give away some tokens to our presenters.